My name is Richad Harvey. I'm an ENT surgeon or otolaryngologist by training, but I only look after disorders of the nose and sinus, and that makes me a rhinologist. I look after patients who have both inflammatory and infective conditions of the nose and sinus, but I also look after tumours and cancers in the area, and I also do nasal reconstruction and complex rhinopasty work. Having this background makes me part surgeon and also part immunologist of the upper airway. Our understanding and the science about how we breathe has changed dramatically. As human beings, we don't perceive the airflow itself through our nose. Our nose is a site in our body in which we perceive the cooling. So there are temperature sensors in our nose that perceive the cooling effects of airflow. So as the air flows over the lining of the nose, it cools it. There are conditions that can affect that, such as a septal deviation or a structure in the nose. And the reason that gives us a sense of blockage is that it impairs the cooling effect. And then there are conditions such as allergy and hay fever, which is, while they're active in the nose, always makes the nose feel warm, and it always feels a sense of congestion, even if we're still breathing through our nose. So it is the cooling effect in how we feel that we breathe. And this is why menthol and other additives are given in cold and flu treatments. They give us a sense of breathing rather than truly opening up our nose. People who are likely to have a structural problem for the reason they can't breathe are those that have unilateral nasal blockage, where they can tell they're not shifting air through one side of their nose, or their nose collapses on one side when they breathe. These are patients that often have external deformities of their nose. Their nose often isn't symmetric on the outside. They may be younger patients who have orthodontic or dental misdevelopment or maldevelopment. Patients who are unlikely to have a structural problem in their nose are those patients whose nasal blockage fluctuates from left to right sides, changes because of their position, such as standing or lying flat. There are likely to be other causes here than the structure. Patients have a perception of nasal blockage for all sorts of reasons, but I think if someone's sense of nasal breathing is tied in with a sense of suffocation or a feeling of shortness of breath, it's unlikely the nose is the cause. The nose is not involved in gas exchange, it is merely just a conductor, and therefore it's not really involved in feelings of shortness of breath and oxygenation. Likewise, if someone has a belief that their nose is going to improve their sleep or energy levels, yet they have very few daytime symptoms, this is unlikely to get a benefit from simply modifying the nose alone. Sometimes nasal surgery is oversimplified. It really is surgery to improve airflow, and there are three structures that are often manipulated. The septum can be crooked or bent to one side. The nasal valve or the cartilaginous framework of the nose is often part of the reason why some people can't breathe. After previous rhinoplasty surgery, it can sometimes collapse. It can collapse with age alone. It can collapse after other forms of trauma. The turbinates are often part of the reason why some people can't breathe. There are conditions such as allergy which can result in large turbinates, and therefore these need to be modified. But it is a combination of having the septum, the turbinate, and the nasal valve structures which are often contributing to someone's blockage of airflow. In rhinoplasty practice, to change both the shape and function of the nose, one either needs to preserve the support mechanisms in the nose and be very conservative in how they're manipulated, or simply to reconstruct the nose and re-support the nose. There's really not a place for surgery in between. Surgery in between produces unsatisfactory results, and this is a very important part of modern day rhinoplasty practice, that one either preserves the support mechanisms or reconstructs them formally as part of their approach.